Hi everyone, I am Dr David Cartland, the Anti-Vaxer from Cornwall. I'm here at the World Council for Health Detox Fair this weekend to discuss ways of fixing the problems that have been caused by the medical profession in the last 3 or 4 years during the pandemic era. The reason I find myself here is that I've been kind of kicked out of the medical profession for some pretty heinous crimes. The first crime is I was unhappy as working as a GP in the Cornish area, that when they brought the vaccine out, the vaccine was kind of rushed through to the market for starters without a sound evidence base. The second thing was they were coercing patients and asking them to have jabs to be able to travel, to be able to work, and never in my career had I ever witnessed the level of coercion that I saw from the patient. So that was an ethical concern I had. Seeing what was going on at the vaccine centre, I saw a lot of a lack of informed consent. So that was another ethical breach that I was very early kind of picking up on, really, as to something I'd never witnessed in my career. So I spoke out about that, and it fell on deaf ears. The real eureka moment for me came as I received 2 jabs myself. So I was coerced myself into keeping my job by having a jab, only to find they changed their decision short 2 days, I think, after. They reversed their decision to mandate it for NHS staff. But the main reason was, I was personally unwell from the second vaccine. I felt really unwell for some time afterwards. I was in bed for 3 days, actually, with severe headaches, and started to see patients come in to see me that had gone from good health towards a whole variety of negative health outcomes, and within a close proximity in time, in terms of fit and healthy 25-year-old having an onset of a reactive arthritis, a blood clot, strokes in 30-year-old fit and healthy patients, heart attacks in 30-year-olds without any vascular history or risk factors. And so started to see, my ears had pricked up really as to, this is not usual. We never normally see these sorts of diseases. And there was always that link to, I was well, I had the vaccine, and then this ill health came upon them. So I started to and at the same time I actually noticed that people who were allegedly getting COVID over and over again, I think we were up to 3 jabs at the time, I'd started to realise this, that everyone who was having positive tests were fully vaccinated to stop them getting COVID, yet they were still getting it, and they're still going to hospital and still allegedly dying from COVID as well. So that didn't fit the narrative that the BBC were telling people. So we had the ethical breaches, the patient safety concerns of me seeing what I felt were tight correlations between administering the vaccine and suffering ill health of a vast variety of different things. It's my professional duty really to raise concerns, were we telling patients that this was a novel technology that had never been used on humans? Fact of the matter, yet we were giving it at the time to younger and younger cohorts of healthy people that wouldn't have naturally become ill if they did catch alleged COVID. And so that's the third crime really, was that I was following an evidence-based practice. I was looking at the Pfizer documents, some of the clinical trials, reading in and around some of the things that spike protein was capable of doing to the human body. And then finally, the fourth chapter really in my GMC's wish to strike me off was to notice that these vaccines were linked inextricably to these health outcomes, negative health outcomes, and started to flag it up to patients and started to research, how can you detox the body. One of the things we're discussing over this weekend is how to, detoxify the body and use supplements and dietary nutrients, etc., to fix the body and to heal it from a toxic situation, generally speaking, and also in terms of the spike protein from the mRNA vaccine. Unfortunately, I tried to raise the concerns in the formal manner, tell my colleagues, senior partners at the surgery's practice managers, local medical boards, fell on deaf ears. Coffee rooms, I tried the coffee room approach, walking into the coffee room with nuggets of information, documents I was leaving around in the vicinity. They were never read, no one ever engaged in debate. And so unfortunately I then had to sort of leap into the world of doing interviews and podcasts, and sadly that wasn't the mainstream media. BBC would never have me on, even GB News wouldn't have me on. I was too outspoken for them. And then I found myself in the situation where my own regulators were forming a bit of a witch hunt, for want of a better phrase, quite an understatement really, in that they I think the last time I counted, I've got 12 complaints, active complaints, and subject to a 15-day tribunal up in Manchester at GMC HQ in October. The crimes are, for me calling out these doctors, they've levied complaints that I'm a bully, harasser, inciter of hatred for essentially calling out demonstrable lies from these famous TV doctors on mainstream media channels. Hoping for a good outcome, but unfortunately GMC haven't left me alone with just the October case. They've lined up a series of subsequent complaints about Twitter posts, etc., and pretty much everything I say and do at the moment is being taken down and used as evidence against me. But yeah, so I'm looking at alternatives really, and a lot of networking gone on this weekend where I've met good people in naturopathic circles, let's say, who are looking to work more towards looking at root cause analysis for why we become ill in the first place and helping heal the body, which is something that doctors these days don't tend to do. They patch you up, they give you a surgery, they give you a drug to control a symptom. But what we stop doing as doctors now is looking at the root cause analysis. Why is that person ill in the first place? What are the common denominators? What is the actual disease process and how do we negate it? And so that's what I'm really interested in at the moment. And I've set up a new service where I'm looking at consulting patients as a health coach now rather than falling within the regulatory capture of the GMC. And it's given me a lot of freedom to be able to speak about what I wish and speak about medical, nutraceuticals and health supplements that will actually help the patient get better. Lots of people on Twitter contact me, paramedics, nurses, doctors, agreeing with me, but silently, and that is a real frustration at the moment because my ethos has always been, if we all stand up together, they can't strike us all off.